I'm Julie Barkey with Senate Update. 3 Senate Republicans unveiled proposals on Thursday they say would reform MNsure, which is the state's online insurance exchange. Senators Paul Gazelka, Julie Rosen, and Michelle Benson each explained the changes they believe need to happen to make MNsure work more efficiently.
Early next week, the nonpartisan legislative auditor's report will be out on MNsure. Every indication will confirm what Republicans have been saying all along, and that is that MNsure has been a colossal failure. I'm not sure who deserves the most blame. The governor and the Senate and House Democrats for refusing to listen to Republican ideas and industry experts to help make MNsure better. The MNsure board for their lack of transparency when everything was falling apart. Or the Department of Commerce, who pressured Preferred One to lower their rates more than once, causing them to drop out of MNsure this year, leaving 60% of MNsure policyholders out in the cold. From the very beginning, virtually all Republican ideas were rejected. As a result, I'm not sure that there's another state health insurance exchange that is floundering as bad as MNsure. And as a result, Minnesotans are frustrated with the process and paying more for their health insurance than they needed to. The beginning slow start of MNsure is at best only improved slightly. The board is not transparent enough and has little expertise in the health insurance industry. Insurance agents and brokers, who are the primary group to help folks get qualified plans through MNsure, have dropped out of participation. 75% of the agents that helped last year no longer help this year. The ease of navigating the web to get a plan is still not good. We continue to require millions and millions and millions of dollars in extra money from the feds and the state to shore up MNsure. There's an old adage, if you're in a hole and you want to get out, the first step is to stop digging.
We all know MNsure is on life support. The OLA report that is coming out next week will most likely verify this. And 2 years ago, I stood with the MNsure authors at this very podium in the hope that we could build a product that would serve the purpose it was intended to serve, the health care for all our Minnesotans. I believe the Senate author had the best intentions and did what he could to build that product. However, we now have Senate File 153 and many other proposals before us that are needed to fix MNsure. I consider my bill, Senate File 153, as the common sense bill, full of measures from the amendments that we tried to pass and offered 2 years ago in the sincere attempt to create a program that worked, a program that is in dire need of accountability and transparency. This bill would have the Commissioner of Commerce publish new insurance premium rates on October 1st of every year, adding that transparency to the system. Any increase in premium taxes to fund MNsure must be approved by the legislature. We have been sorely missed in this whole process. Background checks are required for all MNsure navigators and in-person assisters. All health plans that meet the requirements of the ACA must be offered for sale through MNsure. Also, all the rules adopted by MNsure board must be approved by the Legislative Oversight Committee. This bill would also require MNsure to complete an independent third-party audit and review of all the costs. We need to get a full accounting of the financials of MNsure. How has the money been spent to date and going forward? And how will the 3.5% premium tax and DH funds be used to pay for the system? These are very, very important questions that we cannot seem to get an answer. We would modify the board's representatives and the process for appointing members to the MNsure board, adding industry experts and business representatives. We would repeal the existing conflict of interest and add the federal conflict of interest standards. And it would also require MNsure to report the number of previously uninsured Minnesotans who received health insurance from the exchange.
I introduced a bill. It will be read into introduction today not so much as a final solution, but as a clear voice that we need a strategic change in the way that MNsure operates. 91% of MNsure enrollees are public plan enrollees. 9% are private plan enrollees. MNsure is serving two masters, and it's serving neither well. When MNsure faltered, two groups saved it: the Department of Human Services and the counties, and then the private insurance plans and the brokers. DHS and the counties have always been responsible for the public plan enrollment. 91% of MNsure enrollees could have been handled by the Department of Human Services and our counties. They took on extra paperwork, long hours to enroll customers and consumers, and MNsure made their job harder. They can't even add newborn babies to our MA program because of what MNsure did to them. Despite over $180 million spent on MNsure technology, our county IT systems were left behind. For the private insurance plans and brokers, they have been experts in enrollment and consumer choice since they began. They did most of the work to enroll customers into qualified health plans in spite of the obstacles MNsure put in place. And even now, MNsure cannot communicate in standard industry protocols. MNsure is failing, and it's time for a strategic change in direction. Where do we go from here? The ACA is still the law of the land. And MNsure, Minnesota's form of Obamacare, has to keep some of those provisions. But our one-size-fits-all approach has proven to be a failure. Our consumers need more options and our counties need help. And the answer is not throwing good money after bad. It is time to change our strategy. Our public programs should be taken care of by the Department of Human Services and our counties. So let's repurpose our MNsure IT. Let's put the Department of Human Services in charge of determining eligibility, as they do for so many other programs like food stamps. Let's modernize our IT systems at the counties and human services instead of focusing on MNsure. Let's catch up with states like Florida, Pennsylvania, Massachusetts, and Wisconsin who already integrated their eligibility systems. And then for the 9% in the private plans, let's look to where our successes were before. The MSHA model, people trusted. It met the essential needs of that class of consumers. So let's use that board structure and develop a new organization that can work on qualified health plans with a unique perspective on those consumers. In my opinion, as long as the Affordable Care Act remains the law of the land, we have to work within those confines. I do not think Obamacare is the right answer for health care in the United States and in Minnesota, and I have said since the beginning, I would rather sit across the table from Tony Laurie and make a plan that works for Minnesota than simply do what Washington says. And Governor Dayton led us down the primrose path and got us into MNsure. He didn't listen to any of our points about how it would fail, and now we're at the point where failure is widely acknowledged. And so while the ACA remains in place, we will be cooperative. But one of the advantages of separating our qualified health plans into a nonprofit is that if the AC goes away at the federal level, we don't have entrenched in a government bureaucracy or qualified health plan enrollment. We don't have to worry about money being transferred between a government entity and the qualified health plan enrollment. We can see transparency for our consumers.
I visited with Senator Benson, who is the chair of the Commerce Committee, and he and I both agree that we need to start figuring out how to make this better. And he has agreed that we should be hearing not just Democratic ideas, but Republican ideas. And to your question, Senator Laurie, within the last week, has begun to reach out. And that's why I say I feel like we're at the bottom of that hole that's been dug, because we're actually talking about some of the ideas that perhaps should have been included in the beginning.